students, this is Dawn Hunter, and I'm going to be talking about wound healing in this lesson. So wound healing related to permanent cosmetics is something that is very important that you understand. I know that you probably have some understanding of it. I'm going to go deep and dig in a little bit into the physiological side and how the body all processes it related to permanent makeup, and hopefully you'll learn a little pearl out of that, or maybe I'll show you something you just didn't think about. So wound healing is very important. It's what heals the ink in the skin. So technically we're creating wounds, a controlled wound in the skin, and the skin is then responding and hopefully holding that pigment in where we want it. So let's talk about this very, very important process. It's important that you understand it because I figure if you're gonna put a wound in the skin, you should know how it's supposed to heal, okay? And there's some common myths out there. I'm gonna cover how the process of wound healing occurs, what happens in the body and why it's so important that these things happen, what's normal wound healing, what's not normal, and then make sure that you have an understanding of what the process is that you're going through with your clients so that you know what normal is and what not normal is. And also we're going to really focus this on the eye today because this is for the eyeliner series, and so we're going to focus on how does the eye actually heal from wounds. This is very interesting. All right, let's get started. So we're going to start off with, here's our eye. I'm going to draw a little eye for us, nothing too special today. So here's our eye, here's our pupil. We've got our cornea and we've got our eyelids up here, okay? And we are doing tattooing. And let's say we've done a beautiful, nice cat eye tattoo. So we've done our little ink in here. We've flared this out a little bit. We've done some work here and we've made this beautiful kind of cat eye, a little bit of a natural cat eyeliner. So now that this is going on, what is actually happening as soon as we hit our tattoo needle into the skin? This is what I want to cover and the process that goes on when the skin is trying to heal and keep that ink in there. So again, we're going to reference something that I love, the brain. Yes, the controller, the general, the everything. I want you to think of the brain as the general in wound healing right now, okay? So it is the leader of the military defense, which is your immune system, okay? So we all have an immune system, and this is basically our defense. This is what helps us stay alive and helps us keep going, and it's our kind of military. Now within our military, we've got some branches, right? We've got the Army, we've got the Navy, we've got the Marines, okay, and we've got the Air Force. Now, under the Navy, I'm going to put in SEALs as special ops, okay? So we actually have this in our body, if you think about it, and each one of these regions of defense have a special job to do, and their job is very important. So let's go through a little bit what these guys do and then how it works when we are healing from a wound. So if we want to think about the healing process of our military defense, let's name these guys out a little bit. So first of all, let's think of our Navy SEALs as this cell called the macrophage. Okay, and macro meaning large and phage meaning to eat. A lot of medical terminology comes from Latin, so if you understand a little bit of Latin, then you might get this pretty easy. So macrophage are what I call the Navy SEALs, and what they do is they go around and they are scavengers, and they basically eat up any foreign invaders that they find, okay? They're solo, they go in, they're stealth, kind of like the SEALs, right? They're a covert operation, you don't even know what's happening, and they go in and they just seek and destroy. Their whole job is to destroy any foreign invaders. That's all it wants to do, okay? So that's what these macrophages do. We also have the Army, which I consider like the T cell group. We've all heard of T cells. They're just a group of cells that come in and they have lots of little jobs to do within our wound healing. We've got the Marines and we've got the Air Force. So the Air Force is going to be basically like your cleanup crew, okay? They basically go in and they do the scab formation. They help with the lymphatic wound closing. Okay, so they actually close the wound and they help with scab formation. The Marines also have their area. They actually bring in the histamine which is when you've taken an antihistamine, you're basically trying to control histamine release. So these guys have a cell called the mast cell that they release, and they go in and they all have a purpose. So what is the purpose of all these guys going on when we're looking at how the eye will heal after we tattoo? Well, the first thing that we see when we do a wound in the skin is the brain is going to get an alert, and it gets it through what they call a chemical messenger. Okay, it's a chemical messenger. Whenever there's tissue trauma, there's chemicals released. The brain hears about it, and the brain goes, whoa, go see what's going on down there. Something's happening and I don't like it. So it's going to start sending out the immune system to go out there and see what's happening. Now, when it comes to the eye, what it's going to do, it's going to send out these, we've seen the eye kind of maybe get a little bit red, right? So what happens when the immune system goes out or gets alerted, the blood vessels can expand a little bit depending on how strong the signal is. And these macrophages, they actually come out in a little hole, and they blob out of that, and they actually travel over to the site. And what they're doing is they're looking to see if there's any bacteria that's gotten in or any foreign invaders. Now, if there's nothing there, you've used good, clean tools, and you've got good sanitation techniques, which I know you do. There should be nothing that the macrophages have to do. They're just going to go and they're going to see, there's nothing there, I'm just going to go away. So they come in, and what you'll notice is a slight swelling will start to occur, because what happens is the histamine is coming over, it's releasing histamine, and that brings fluid with it. So when you start to see a slight swelling, that's completely normal. There's nothing wrong with swelling. It is actually the first phase of healing. Now, like I said, there's normal and then there's not normal. So if you see an extreme amount of swelling, right, like where the eye's just getting huge and blowing up before your eyes, that's not what I call normal wound healing swelling. That would be probably an allergy to the anesthetics, or there's too much aggressive tattooing going on where you're traumatizing the skin too much, or you've wiped it too aggressively. Okay, so something's happened to either traumatize the tissue or it's having an allergic reaction to something. Now, I have seen both from students. I have seen allergic reaction to anesthetics, and usually what you'll see with that is the eye swells right when you're wiping the anesthetic off. It also will cause more residual diffuse redness over the whole eyelid. So that's one indication. If you go too aggressive with your tattooing, you're going to see tissue that looks like beat up and kind of red and traumatized, and it's going to be more local to where that is. And what will happen, especially with the eye, because the eye can swell to infinity, it really can swell a lot. There's nothing packing that eye in. There's no borders, there's no bone other than the orbit. So it can just keep swelling. So you'll see a big ball of swelling if people have gone too aggressive. It kind of balls out like that. It literally looks like someone's almost been hit in the eye, and you'll start to see it just welt. And so if that's happening, usually that means you're way too aggressive on your tattooing. So you need to back off. And in fact, what I would say, if it starts at that point, game over, you need to send them home and just let it heal up and have them come back. So don't be aggressive on your tattooing. Learn proper technique. Because once that starts to swell, game over. You cannot tattoo properly on swollen skin. It's got too much fluid, it's got all the histamine mast cells going on there. Now it's sending in, also the T cells are coming in, and then the cleanup crew is getting ready to take on board. So you're gonna have lymphatic stuff, I call it sap, coming out. And so it's really important, I cannot stress enough, that you don't be aggressive on your tattooing, okay? So you'll see this bolus happen of swelling if you're going too aggressive. Now normal, very good technique, honestly, there's very little swelling. I have clients leave and they look like I just painted makeup on them. You do not have to have swelling to have a good outcome, okay? More aggressive traumatization, more swelling. So that should be your guideline if you're in the right technique. My clients leave, they look like they just have a little bit, maybe they've just had went to a movie and cried a little bit at some tearjerker, if that at all. Oftentimes they leave and it just looks slightly puffy. It just looks like the eyeliner's bigger. So you really should not see that. The other thing I do not see generally very much of is any bleeding. So you should not see a lot of bleeding at all with the eyeliner. If you are bleeding the eye, you are going way too heavy and too aggressive. So it's a good rule of thumb to know what the indicators are of overworking the skin, okay? I reapply the anesthetics too as I'm treating the client. So I'll apply my layer and then I use my epinephrine layer to control any kind of little pinpoint bleeding and swelling. So these guys come along, the macrophages come to check out. If there's nothing there, they go away. If there is an infection, what they'll do is they'll start eating all those bacteria and then the body will whisk it away. If it's a really bad infection, that's what pus is. Okay, so if you see pus or you see a big bolus of like, you know, something happening going on, that is actually meaning, it's actually meaning the body's doing its job. The macrophages have now gone in and eaten all those white blood cells and contained them, and then they're coming up in a nice little bowl here with a little whitehead, and they're gonna try to get them out through the body. So whiteheads and pus is actually your own body dead cells that have killed the bacteria and are trying to get out of your body now. The bigger the infection, the more pus you're gonna see. There's things called boils and carbuncles. Usually that's people that have immune system issues too, or it depends on what kind of strain of bug has gotten in there. If it's like a really strong bug, you're gonna have so much of these macrophages there, it's just gonna make a huge, you know, boil, and it's gonna try to get out as fast as possible. So you don't wanna mess with those infections, okay? The old rule of thumb is don't pick at your, you know, at your boils or whatever, you know, is so true, because if you drive it deeper, you could be driving infection deeper. So if you have a client, I've never had this happen, but if you do have a one-off where a client texts you a picture after and they're like, hey, is this normal? And you see like pus around their eye, absolutely not. Send them into their doctor like right away. There's something going on. You don't, it could be nothing. It could be they scratched their eye with their dirty nail after the technique, or often I find this moms that have babies, the babies touch their face. So if the baby got their fingers around the eye and the eye's still freshly tattooed, you could get an infection that way too. So sometimes it's nothing, it's just, you know, they go to the doctor, doctor gives them eye drops. Typically they'll give them antibiotic eye drops, maybe some oral. They generally don't give topical around the eye because they don't want it getting in the eye. So, but normal healing, you should see really nothing. I generally think that, tell clients that when their eyeliner is healing, it heals kind of like a dry mascara. So the ink should, you know, the scab should just crumble off like dry mascara, if at all, and that should be the extent of their scab. They should not have thick, crusty, gunky scabs coming off. If they do, you've overworked the skin, and a ton of lymphatic has had to gone out there. So the more you overwork the skin, the thicker the scab is gonna be. I'll say that again. The more you overwork the skin, the thicker the scab is gonna be. So that's a good indication if you're going too heavy, you're working it too hard. The more you work the skin and traumatize it, the more of the Air Force guys have to come out and clean it up. So they have to make a bigger scab, and they have to send out way more lymphatic stuff. So the lymphatic is kind of the ooze that comes out filled with nutrients and enzymes and things to build the scab and to kind of finalize that healing process. I typically don't see the eyes sweat as you do sometimes with people that overwork the skin. If you overwork the lips, you can see them sweat. I've seen eyebrows sweat. Anytime you're just over traumatizing the skin, and people's skin's different. What can be over trauma to one person can be nothing to another. Typically what you'll find is the Fitzpatrick higher tend to have way more tolerance for tattooing than Fitzpatrick, I'm sorry, switch that. So Fitzpatrick, no, I said it right. I'm having a brain moment. Okay, so Fitzpatrick 3, 4, and 5 and up will handle tattoo better. Fitzpatrick 2 and 1s, their skin is thinner. The epidermis is thinner, it's drier, it's not gonna handle it as much. So remember to pair your tattoo with the skin type when you're working, especially around the eye. Okay, so if you notice a little redness in the eye area in the sclera, that's totally normal. Usually that'll dissipate within, you know, a couple hours, and most likely it's linked to the anesthetic and also just the general wiping and flushing of the eyes. So I wouldn't be too concerned. If a client texts you later and it's beet red, yes, that's a concern. That means something else is going on. It could be they've got an infection, they've got a virus in their eye called pink eye or conjunctivitis. You know, those are things that, you know, could happen, but you definitely would want to send them to their doctor. And we're going to talk more about how to wipe properly so that you don't traumatize the eye on your wiping. I've seen people wipe so aggressive, it's so ridiculous. There's no oil glands around the eye. It's very dry, so you have to be very careful when you're wiping. I also like to use a lubricant. I tend to use a light Aquaphor, just a tiny bit on the eye when I'm tattooing. It helps the needle move along, but for aftercare, you don't want the clients using petroleum products. They usually get them in the eye, and that will make their eye beet red too. The other thing is when you send your clients home, you want to make sure they're using saline solution as their eye drops. I did have a client one time mistakenly buy contact lens solution cleaner and put that in her eye. Poor babe, she called me up, her eyes were beet red. We figured out, I saw the label, English was her second language, and so she had bought the wrong stuff. So make sure, either send them home with the right stuff for saline, or tell them that, you know, please make sure you ask the pharmacist, is the saline solution that I'm getting? And I like them to get a brand new bottle. I like them to have something that's fresh and clean and never been opened. So I usually put that on the client because I find that those little individual ones, they don't give enough flushing. You just put one drop in there, but they're not bad. They're not bad, don't get me wrong. I also will use Celluvic, the thicker eye gel, when I'm going to be tattooing on eyes that tend to be more mature and dry. Most people's eyes do fine. I try to do the least amount that I have to put in and on their eye when I'm working with them. So other than that, I think this is it. We covered wound eye healing. The eyes should heal very quickly, typically about 3 to 4 days for someone with healthy, normal eyes. The external side will heal. I always give it 1 month in between though. I'd like to have 1 month of internal healing because I want to make sure that the tissue on the deeper inside is completely healed before I work on them again. So a good rule of thumb, give them 4 weeks in between. Even if you're doing a second session, you still want that tissue to heal up before you start tattooing again. And other than that, I think we're good. So I'll see you in the next lesson.